Hey there! Welcome to our channel. Today, we're diving into the biochemistry of obesity, covering its definition, different types, causes, prevention tips, and treatment options. We'll also learn about the role of the OB gene in obesity. Stick around for an easy-to-understand and informative session. Let us start with the definition of obesity. Obesity is a medical condition characterized by an excessive accumulation of body fat that presents a risk to health. So, it is a condition where too much body fat poses significant risks to overall health. It is typically measured using the body mass index, BMI, which can be calculated by using a person's weight in kilograms divided by the square of height in meters, kg per meter square. A BMI of 30 or above is classified as obese. Now, let's learn about the different classifications of obesity. Obesity can be classified on the basis of three different factors. They are: first, based on BMI values; second, based on fat distribution; and lastly, third is classification based on cause of obesity. Based on BMI, obesity can be classified into three classes, where overweight is defined as a BMI of 25 to 29.9. Obesity Class 1 ranges from 30 to 34.9, Obesity Class 2 from 35 to 39.9, and Obesity Class 3, severe or morbid obesity, is a BMI of 40 or higher. Based on fat distribution, obesity can be classified as android and gynoid obesity. Android central obesity is characterized by fat primarily accumulating around the abdomen, giving an apple-shaped appearance. In contrast, gynoid peripheral obesity involves fat being distributed around the hips and thighs, resulting in a pear-shaped figure. Here is a picture showing apple-shaped appearance and pear-shaped appearance. Visceral obesity, characterized by fat accumulation in the abdominal cavity, is more closely linked to metabolic diseases compared to subcutaneous obesity, which involves fat stored beneath the skin and has a lower association with such health risks. Lastly, we have the classification of obesity based on cause. Primary, simple obesity results from excessive caloric intake and insufficient physical activity, while secondary obesity is due to underlying medical conditions or medications, such as hypothyroidism or Cushing's syndrome. Now let's understand the different causes of obesity. Genetic factors play a significant role, with a family history of obesity and genetic predispositions affecting metabolism and fat storage contributing to the risk. Environmental factors also have a major impact, including high-calorie diets, sedentary lifestyles, and the effects of urbanization, which bring about changes in dietary habits. Psychological factors, such as stress and emotional eating, as well as depression and anxiety leading to overeating, further exacerbate the condition. Additionally, certain medical conditions, including hypothyroidism, Cushing's syndrome, and polycystic ovary syndrome, PCOS, can contribute to obesity. Medications like certain antidepressants, steroids, and antipsychotic drugs can also play a role in weight gain and obesity. So now, how can we prevent obesity? Here are a few strategies. Embracing healthy eating is crucial, which includes consuming a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, while avoiding high-calorie, low-nutrient foods. Engaging in regular physical activity is also important, with recommendations of at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity per week, along with strength training exercises at least twice a week. Behavioral changes, such as practicing mindful eating, avoiding emotional eating, and monitoring both food intake and physical activity, can further support prevention efforts. Additionally, community and policy interventions, including public health campaigns promoting healthy lifestyles and policies designed to reduce the availability of unhealthy foods while increasing access to healthier options, play a significant role in addressing obesity on a larger scale. There are 4 approaches to treat obesity: lifestyle modifications, medications, surgical interventions, and a multidisciplinary approach. Let's look at them one by one. Let's start with lifestyle modifications. This approach includes dietary changes, which involve personalized diet plans aimed at reducing caloric intake while maintaining nutritional adequacy. Physical activity, which focuses on gradually increasing physical activity tailored to individual capabilities and preferences, and behavioral therapy, providing counseling and support groups to address the psychological aspects of eating and activity habits. Medications for obesity include appetite suppressants, which are drugs designed to reduce hunger, such as phentermine and liraglutide, and fat absorption inhibitors, which help decrease fat absorption from the diet, with orlistat being a commonly used example. Surgical interventions for obesity include bariatric surgery, which encompasses procedures such as gastric bypass, sleeve gastrectomy, and adjustable gastric banding to reduce stomach size and limit food intake, and liposuction, a cosmetic surgery aimed at removing fat from specific areas, though it is not a treatment for overall obesity. Lastly, the multidisciplinary approach involves a combination of dietary, physical, behavioral, and medical interventions tailored to the individual's needs and health status, ensuring a comprehensive and personalized treatment plan for obesity. Now let's explore the OB gene and its role in obesity. The OB gene, also known as the LEP gene, is responsible for producing leptin, a hormone crucial for regulating energy balance, appetite, and metabolism. Produced mainly by adipocytes, fat cells, leptin signals the brain to manage food intake and energy expenditure, thereby influencing body weight and fat storage. Leptin plays a central role in regulating energy homeostasis. Leptin production involves its secretion by fat cells in proportion to the amount of body fat. As body fat increases, so does the production of leptin, creating a feedback mechanism where higher fat stores lead to elevated leptin levels. Leptin signaling occurs when leptin binds to receptors in the hypothalamus of the brain. This binding signals the brain to reduce appetite and increase energy expenditure when fat stores are sufficient. Conversely, when leptin levels are low, indicating low fat stores, the brain is signaled to increase appetite and decrease energy expenditure to restore energy balance. In terms of regulation of appetite and metabolism, leptin inhibits the production of appetite-stimulating neuropeptides, such as neuropeptide Y, NPY, and agouti-related peptide, AGRP. At the same time, it promotes the production of appetite-suppressing neuropeptides like proopiomelanocortin, POMC, thus playing a critical role in maintaining long-term energy balance and regulating body weight. Now let's understand the link between OB gene mutation and obesity. Leptin deficiency occurs when mutations in the OB gene result in either a deficiency of leptin or the production of non-functional leptin. This impairment disrupts the body's ability to regulate appetite and energy balance effectively, leading to hyperphagia or excessive eating and consequently severe obesity. Without functional leptin, the usual signals to reduce food intake and increase energy expenditure are lost. Leptin resistance is a condition where, despite normal or elevated levels of leptin, the body fails to respond effectively to the hormone. This resistance is commonly observed in individuals with obesity and is characterized by an inability of leptin signaling to suppress appetite and enhance energy expenditure. As a result, the regulatory function of leptin is compromised, contributing to continued weight gain. Both leptin deficiency and leptin resistance highlight the complexities of obesity beyond simple caloric imbalance, illustrating how genetic mutations and disruptions in leptin signaling can profoundly impact appetite control and energy homeostasis. Now let's summarize the role of OB gene in obesity. Genetic obesity refers to rare cases where severe obesity is caused by mutations in the OB gene, leading to congenital leptin deficiency. Individuals with this condition experience extreme hunger and rapid weight gain from an early age due to the lack of functional leptin, which is essential for regulating appetite and energy balance. Common obesity, on the other hand, is typically associated with leptin resistance rather than leptin deficiency. In these cases, individuals have elevated leptin levels due to increased fat stores, but the signaling pathways are impaired, preventing leptin from effectively regulating appetite and energy expenditure. This resistance complicates the management of obesity and contributes to the ongoing challenge of weight control. Implications for treatment include the use of leptin replacement therapy, which has been effective in treating congenital leptin deficiency by leading to significant weight loss and improvements in metabolic health. However, addressing leptin resistance remains a complex issue, with current research focusing on enhancing leptin sensitivity and improving its signaling pathways to better manage obesity in the broader population. To conclude, the OB gene and its product, leptin, are fundamental to the regulation of body weight and energy homeostasis. Mutations in the OB gene can lead to severe obesity due to leptin deficiency, while leptin resistance is a common feature in many cases of obesity. Understanding leptin's role in appetite regulation and metabolism is crucial for developing effective strategies for preventing and treating obesity. This complex condition involves multifactorial causes, including genetic, environmental, psychological, and medical factors, and has significant health implications. Effective management requires a comprehensive approach that combines lifestyle changes, medical treatments, and in some cases, surgical interventions. Preventive measures such as adopting healthy eating habits and engaging in regular physical activity are essential to addressing the obesity epidemic and enhancing public health. Ongoing research aims to improve leptin signaling and explore novel therapies to overcome leptin resistance, striving to better manage and reduce the impact of obesity on individuals and populations. To get a better grasp on BMI measurements and their limitations, check out our video on the topic. It's packed with useful information that'll boost your understanding. If you enjoy this kind of educational content, don't forget to subscribe to our channel. By subscribing, you'll have access to even more videos that make learning fun and easy. Happy learning!